I'm Jessica Chen, and I'm a physical therapist at Gary Souza Physical Therapy, and I take special interest in treating patients with pelvic floor dysfunction. My interest for pelvic health therapy grew while I was in grad school, and I had the opportunity to work with a lot of patients who had pelvic floor dysfunction. I was also able to observe some surgeries that were pelvic floor related, and I realized how much this small group of muscles in the pelvic floor can do for the body and how under-recognized it is in the world of physical therapy. It's an area of the body that many people don't know about, so I'm hoping with my interest and passion in the field of pelvic physical therapy that I can bring more light and awareness to this region of the body and give my patients education and tools needed to be able to rehabilitate the pelvic floor. The pelvic floor has three main functions, and we call it the 3 S's. It has a supportive function in which it supports the pelvic organs and all the abdominal organs above it. It has a sexual function in which it contributes to erectile function in men and orgasmic function in both men and women. And it also has a sphincteric function for the bowel and bladder in which it contributes to maintaining continence. So when there's a disruption to the pelvic floor, whether it be from trauma, surgery, childbirth, or just general pain and muscle tightness, then there could be a disruption in one or more of these functions. A huge misconception about pelvic health therapy is that all we do is teach patients how to perform Kegels. I hear it from my friends, my family members, and some of my colleagues too when they ask me what I do in pelvic health, and they think that all we do is teach patients how to contract their pelvic floor, which isn't the case. Yes, we do teach them how to perform Kegels, but there's a lot of ways that patients can perform it wrong. And a lot of times patients actually don't need more strengthening or more tightness in their pelvic floor because they have trouble relaxing. Another big misconception of pelvic floor physical therapy, or I think more of like a condition, is that urinary incontinence is normal after childbirth. And yes, it is sometimes for maybe just a period of time, but it is definitely not normal for the rest of your lives, and people should not have to live with incontinence. So this is the pelvic floor muscle group. We call it the levator ani. It runs from the front of your pubic bone all the way down to your sacrum. So a way we teach patients how to relax is to pair it with their breath. And we call this diaphragmatic breathing. So when we tell patients to take an inhale, their belly rises, and as their belly rises, their diaphragm lowers and pushes the pelvic floor down, lengthening the pelvic floor and allowing it to relax. And then when the patients exhale, they draw their belly button in. There's a tight little abdominal contraction while their pelvic floor also tightens and contracts. We start sometimes by teaching patients just to how to be aware of the pelvic floor muscles when they have a problem relaxing it. So many people can benefit from pelvic floor physical therapy, and sometimes they don't even know. We see patients with bladder and bowel dysfunction, sexual dysfunction, and pain with intimacy. And we see patients who are prepartum or postpartum, or sometimes after surgery if there's any trauma related to the pelvic floor.